this section, I'm going to discuss how bipolar disorder is diagnosed. Bipolar disorder is a psychiatric disorder that must be diagnosed by a trained mental health professional. Diagnostic interviews and medical evaluations are used to make the diagnosis. There are currently no physical or lab tests that can diagnose it, but they can help rule out other conditions that sometimes have similar symptoms, such as thyroid dysfunction, brain tumor, and drug use. To make the diagnosis, a trained mental health professional will do a thorough interview and pay careful attention to the symptoms experienced, the severity of the symptoms, and how long they have lasted. People with bipolar disorder often seek treatment for their depressive symptoms rather than their manic symptoms. This can result in a misdiagnosis of major depression. A thorough interview is needed to prevent this misdiagnosis from occurring. Major depression can be distinguished from bipolar disorder by the absence of manic episodes. Bipolar disorder shares symptoms with other psychiatric disorders as well. Attention deficit hyperactivity disorder can mimic the manic symptoms in bipolar disorder, such as excessive energy, impulsive behavior, and poor judgment. Some individuals have psychotic symptoms when manic. For example, they might believe they are the president. These symptoms are similar to those seen in psychotic disorders such as schizophrenia and schizoaffective disorder. The symptoms of these disorders, however, differ over time. Individuals with bipolar disorder usually don't experience the psychotic symptoms when their mood is stable, while individuals with schizophrenia or schizoaffective disorder experience psychotic symptoms even during periods of stable mood. Bipolar disorder must also be distinguished from a mood disorder that is due to a medical condition, where mood symptoms are the result of a medical condition. Additionally, bipolar disorder must be distinguished from a substance-induced mood disorder, in which mood symptoms are the result of alcohol or drug abuse, medication, or toxin exposure. That concludes our discussion of what is involved in diagnosing bipolar disorder. Join me next time as we talk about the causes of the disorder.